Okay, good morning, everybody. We are going to get started. Welcome to our December Student Support Series webinar, Schools as Essential Partners in Youth Substance Use Prevention. A little housekeeping. For those of you who have been joining us throughout the fall, you know my name is Kate Bohannon. I'm an education consultant for the State Department of Education. Little housekeeping pieces, cameras and microphones are disabled. Please use the chat if you have questions. As I said, this webinar is being recorded and the recording and slides will be shared with everybody who registers. Confidentiality, we have a large group joining us here today. We want to be able to have open conversations about what we are seeing in our schools, but be mindful of any identifying information. And if you're having technical issues during the presentation, please send me an email. Again, if you've joined us before, you know it may take me a minute because I'm doing the hosting features and the tech support. But I will do my best to get back to you as soon as I can if you have any troubles. Looking at our continuing education credits. So this webinar has been approved for 1.5 CECs. The approval meets continuing education criteria for LMSWs, LCSWs, LMFTs, LPCs, and licensed psychologists. You can see the criteria there to be eligible for these free CECs. At the end of the presentation, there will be a QR code to, fill out the CEC request form. That form is live for 2 weeks. I process it on the 3rd week and you will get your certificates then. Please make sure that you enter your email address correctly. Sometimes folks have said they haven't gotten the certificate, and then I look back and it's because the email address wasn't correct and it got bounced back. All right, a quick look on our agenda. Kelly Edwards, my colleague from DMHAS here, is here to talk about youth substance use and prevention in Connecticut. Bianca from CERC is unfortunately unable to join us this morning. Kelly's going to share the information that she had prepared, but I did still want to have her name up here because she's a great connection for us. As always, I want to ground this webinar in the data. So who are we and who are we here for? You can take a quick look at what our mental health staff looks like in schools, our school districts, and some demographics about our students. All this information is available on EdSite. And then looking at some data specifically about substances, Kelly's going to get into information about what the Youth Risk Behavior Survey says and some other data points, but I just wanted to look specifically at substances in schools. So you can see on the left-hand side here, those are disciplinary incidents. So again, this is all from EdSite. So these are students who received disciplinary consequences for drugs, alcohol, and tobacco from 2020 through 2025. As you might expect, 2020, 2021, because of the hybrid schedule and the pandemic, those numbers were lower. But you can see what that looks like. You know, we had a peak in 22, 23. And then pretty similar over the last couple years. I also wanted to look at this incidence by grades. So you can see that there's a big jump between elementary and the middle school and then middle school to high school, which is to be expected. But I think it's important to keep in mind that if we start prevention in middle school or if we start prevention in high school, then we've already missed the boat. We really need to look upstream and make sure that we are educating our K-5 students, our elementary school students, about what the substances are and the dangers that they pose. Again, this is all available on EdSite. So without further ado, I'm going to pass this over to my colleague, Kelly Edwards. Kelly is a behavioral health program manager at the Department of Mental Health and Addiction Services with over 25 years of substance use prevention experience. She is certified as a prevention specialist in 2016. Kelly manages local prevention grants in over 20 communities, oversees opioid awareness and prevention campaigns for the state, and collaborates on prevention projects with a wide variety of organizations such as the Connecticut Clearinghouse, 8 father-serving agencies, the Governor's Prevention Partnership, and the Connecticut Interscholastic Athletic Conference. Kelly also has years of experience in suicide prevention, serving as a QPR facilitator and a member of the Connecticut Suicide Advisory Board's Intervention Postvention Response Committee. Kelly received her master's degree from Central Connecticut State University in Marriage and Family Therapy and her bachelor's from University of Pennsylvania. I apologize, my Christmas cold came early this year. So I apologize if my voice comes in and out or I cough. But now I'm going to head. I'm so honored to have Kelly here and for her to share all of her experience and expertise with you all.
Thank you so much, Kate, and I hope you feel better soon. I just all definitely going around. Thank you to the Department of Education and to all of you who I know it's a super busy time in the schools. So thank you for taking the time out on this day as you guys are wrapping up for this part of the school year. I'm going to give you a lot of information. It's going to go pretty quick to make sure we get it all in. As Kate had mentioned, you will get all of the slides. There are a lot of QR codes toward the end and a lot of contacts. So if something stuck with you or you want to revisit or you want to bring any resources to your district or your school, all of that contact information is there, and you'll be able to look back and hopefully reach out for any needs you might have. So without further ado, we will get rolling. So go ahead and next slide, Kate. So two months ago, I was able to attend the series where the Department of Public Health shared with you all some data. So I just included a little bit of data so as not to reiterate what they said. And all of this information is from the latest survey that we have, which unfortunately is 2023. The new data should be out hopefully in the spring, but it's the Youth Risk Behavior Survey from 2023. And one of the topics that I know a lot of you, if you were there, had asked for is more information about vaping. So we're going to go ahead and start with that. So this is in 2023. They surveyed Connecticut high school students only. So right now we're just looking at high school students. And these are nicotine-based vapes. And if you're not aware, it is possible to vape alcohol as well as THC, which is the active product in cannabis. But this, we are just talking about nicotine-based vapes. And about 11.5% of our high school students said that within 30 days of the survey happening, they had vaped at least once. And what is popular amongst the young people right now are the disposable vapes, which are like Elf Bar, Geek Vape, Flume, Raz, and Lost Mary, which you may see in different stores. Next slide. This breaks down the into some ethnic categories, the grades, and the gender differences. Across all substances, unfortunately, our young girls, young women are utilizing substances in greater percentages than our young men. So within the last 30 days, again, 13.5% of females and 9.3% reported vaping. Looking at some ethnicities, our white students are vaping at a slightly higher rate than others, and as would be expected, the use rates increase as the grade gets higher. They have increased access, more friends that are doing it, and it's not surprising to see that the rate would increase. Okay, next slide. So this data looks at daily use. So these young people were saying that they are vaping daily, and one might assume, I guess, not that we want to assume, but it seems like if you're vaping daily, you may have a problem with dependency or addiction, which is very easy to do with nicotine. So here again, it kind of echoes the 30-day use where our white students are using at a slightly higher rate. 12th graders are using higher than our ninth graders. And again, the females are a slightly higher rate than our total and our males. Next slide.
I'm just going to jump in really quick, something that I wanted to mention in my data and I had forgotten, but looking at these numbers, right? We looked at the number of students who are caught in schools.
Mm,
Um, clearly there are more students using than are being caught. And also for we're tying this back to last month's on school culture and climate, right? What does that do to your school's culture and climate if there are students who don't want to use the restroom because there are other students using substances in there, or who may find, a vape or a cartridge, I know some students who used to hide them under the lip of the sink, things like that. So what does that do to your culture and climate? So it's not only about the students who are using, but it's also about the community that you're building in your school. So I just wanted to make that point real
Thank you,
quick.
Kate. Absolutely. I've heard the same issues, the bathroom issue primarily, and how do we handle that when teachers are supposed to be in classrooms and this behavior is going on? It's difficult. Okay, so just briefly, a little bit of information about what's the big deal about vaping. Nicotine is one of the most addictive substances, very difficult to quit. For young people whose brains are not fully developed, use and addiction is going to come a lot quicker with an undeveloped brain. There are super high concentrations of nicotine in the liquids. So roughly one pod of liquid, so which is either one disposable vape or a cartridge that gets put into a reusable vape product. One pod is about the same nicotine as 20 cigarettes. Now, most young people say, "Oh, I'm taking a hit. I'm not, you know, taking the whole thing in all at once." But if they're using one a day, still that's 20 cigarettes in a day. So you can imagine the impact on their brain and how easily addiction can happen. Additionally, drawing the liquid over a heating element, so you can see in the graphic there, there's a heating element, the coil holder, the coil. When they inhale and bring the liquid across that coil, um, it creates the vapor that they're inhaling, right? That heating process of that liquid is actually releasing metals, teeny tiny metals that are then being found in the lung tissue. So we're going to talk about THC vapes coming up. Um, so those are some very, very basic concerns about vaping and why it's very dangerous and should be taken seriously. It's definitely not water vapor. All right, next slide. As I mentioned, with the brain, addiction happens quickly. Another issue is the molecules that are inhaled of vapor. They're very, very tiny. So they're smaller than oxygen molecules. They're so small that they're getting into parts of the lung that no moisture or no item should ever be. So that's resulting in pneumonias and bronchitis, and even there's an epidemic a while ago of lung failure. And still to this day, there are young people requiring young lung transplant because the tissue becomes so damaged from inhaling the vapor. And as you would imagine with young athletes or anyone who's, requiring oxygen to be sent efficiently through their body, their performance ability is going to be significantly impacted if they're using vapes. So next slide. Unexpected vape problem that not a lot of people are aware of. Disposal is a huge problem. Most of these have uh, the batteries. You cannot just throw them away in a trash can. They're roughly estimated to be causing 10 tons of lithium being sent to landfill or incinerators every year. So this is a real problem that the prevention community is looking at and trying to work together to provide a way to dispose of them. And at present, we're not getting any much cooperation from the vape industry. It's kind of like, well, you make our product, you figure out how to get, or you use our product and you figure out how to get rid of it. So that's just a lot of our young people are interested in the environment right now. And so this is an issue that they're starting to tackle here in Connecticut. Next slide. All right, a bit about vaping THC. Um, I saw a chat question come up. is there a comparable 20 joints to one cartridge? Not really. We do know that the cartridges with the THC in it, um, that liquid tends to have very, very high potency, more potency than your average um, crushed marijuana, like you would say a cigarette, crushed marijuana cigarette or things like that. Some vape products, liquids are up to 90% THC, which just for comparison's sake, back in the 70s and 80s, the average THC content was 4 to 5% THC, and some of these vapes are up to 90. So that's causing some of the psychoses. Some of you could fall unconscious from this, but we're starting to see more of the mental health and more severe reactions with that high dose of THC. The majority of teens in a 2024 study reported using flavored THC. So that too is a battle with our vapes, our nicotine vapes. They're attracted to the vanillas, the strawberries, the things like that. And one thing that also draws our young people is it's odorless. So they can be vaping THC right in the hallway, right in the bathroom, and you don't get that typical cannabis odor of, that skunky kind of smell. Has no odor at all. So that's attractive to young people that are trying to get away with that. And on our the last survey that was taken in 2023, again, our females are using more often, but almost 10% of high school students report vaping THC within the 30 days prior. So it is a popular way to use cannabis. Next slide. Here are some visuals of what the disposals look like. So just to keep an eye out, if you see them in your class, in your school, they're usually very bright, very attractive to young people. They have either juicy or candy looking graphics on them. But just to give you all an idea of some of the popular products that Connecticut young people are using. Okay. All right, so non-vaped cannabis, I'm going to talk a little bit more in depth about because DPH didn't go this in depth with their numbers either. So I just wanted to give you guys a little bit more information. So while recreational cannabis was legalized in our state in 2020, we haven't seen a gigantic jump, which is really good news. Like I said, I do anticipate what the new data will look like for 2025. But right now, about 15% of our 9th through 12th graders are reporting that within 30 days they had ingested cannabis in some way that was non-vape. So that could be smoking a marijuana cigarette, it could be using a bong or inhaling, or it could be an edible as well. Next slide. So breaking it down a little, as we did with vapes, again, you can see girls a little bit higher than young men. Multiple race, I think that's tough. So I tend to look at just more of the singular categories. So again, white students a little higher than others. And again, seeing the increase as the grades go higher. So we're looking at 2 years ago, roughly 1 in 5 12th graders in Connecticut reporting using cannabis within the last 30 days. Okay, next slide. All right. So this is some information that Kate was kind enough to share for this presentation. Juvenile review boards are, maybe most of you know what that is, but just in case there's someone here that doesn't, juvenile review boards are typically a collaboration between local police or state police, maybe a youth service bureau, the school personnel, and other interested community members that it's kind of a deference from court if a young person is arrested under the age of 18 only, and they will hear the case. They will let me start over. It avoids court. this board sees the case and they'll create diversions for this young person to try to bring them back to a positive track or get them the help that they might need. So looking at the drug-related referrals to the Juvenile Review Board, which could be done by a school, it could be done by a police. Typically, it's through a police interaction, but there were 189 referrals to JRB for illegal drug possession in 24 and 172 in 25. Fewer for alcohol possession, 0 in 24 and 29 in 2025. And then you can see the referrals there for drug paraphernalia. So maybe the young person had a bong or other related items. As far as the interventions, which were the diversions I mentioned, 70 and 97 were referred for drug or alcohol counseling. So in some ways you could look at that and say, wow, out of all of Connecticut, that's a pretty low number. But again, as Kate mentioned, these are the young people that got caught. And I'm glad that we were able to provide those referrals to counseling as needed. But just to give you all a sense of what's going on related to arrests.
I just want to
And
jump in real
then,
quick.
yeah.
So if you look at this, it's an order of percentage. So breach of peace is at the top, followed by disorderly conduct. But if I did some quick math, if you combine the percentages of the illegal drug possession, possession of paraphernalia, or possession of alcohol and liquor, so any of those substance use related your referrals, it comes in second. So it's, breach of peace is by far and away the highest. But if you combine again all those ones that have to do with substance use and the illegal use of
It does.
substances, that comes in second. So I think that's important to keep in mind too, because none of the other categories are divided up in that manner.
Thank you, Kate. Yes, good point. Good point. And so on that similarity, looking at the top four reasons for referral and breaking it down by the Connecticut designations of rural, urban, et cetera, interesting to see here that the suburban and rural school districts have drug possession as their second most common reason for referral. Rural has the drug paraphernalia as their fourth. So that kind of surprised me a little bit, even though I'm in the field a lot. And I just throw the question to you all, what maybe do you make of that? And think about that as we're going along here. Do you think there's a specific reason for that? Are there more services in one place or another? Or, how are schools responding in one place or another? So just I challenge you to let that roll around in your head and see if there's anything that comes up for you. Definitely
Yeah,
would
and
be interested.
feel free to share your chats in the excuse me, share your thoughts in the
Thoughts in the
chat as
chat.
well. Not your chats in the thought. Because I was kind of surprised by that as well. And I can look really quick too. I didn't grab this data, but also what the because it doesn't break it down by it doesn't break it down by referral type, but just also looking at the urban core and urban periphery, they were less likely to be referred for counseling services than our suburban, rural, and wealthy communities. They
Mm,
were more likely to have, write an essay or community service,
yeah,
which kind of stuck out to me as well. So, yeah, just put what you thought, any thoughts you might have in the chat. Again, this is also not unique to schools. This is all juvenile review board referrals. So this
right.
could also be interactions in the community as well.
Yeah, absolutely. Absolutely. Yep. Yep. Good point. Okay, so this is these are actual photos that were taken by some of my colleagues in our department. So I'll start with that. And the next few slides, really, the purpose is to bring your attention to some different phenomena and products that are out there in our state that you might catch glimpse of in a student's backpack, or heck, maybe right out on their desk if they may be so bold. So what we're in Connecticut with our new recreational marijuana laws, the laws for anything edible is that it has to be packaged in a clear very blandly labeled, white labeled with black typing on it for anything that's being legally sold as an edible, right? So that is the law. So if you look at these products right here on the screen that were recently for sale, whether it be in a gas station or a convenience store or one of the smoke shops or CBD stores, these are not blandly packaged. There's not white and black writing. It's very colorful and attractive to young people. But these are some products out there that are being sold to our young people. And they have, as you can see, marked on the packages, THC and CBD. And, serving 5 servings per package, you can see on the purpley blue one. Most kids that pick up a bag of candy are going to eat all of it, right? Like a Kit Kat is being sold out there that has THC in it. And I know when I eat a Kit Kat, I'm taking that whole thing in. Meanwhile, the serving size on a THC filled Kit Kat is only 1 bar. So most young people or people are going to consume all 4 of that and suddenly be way more high and way more impacted than they intended for, simply because they did not look at the dosage. So just something to keep in mind as we go through some of these slides. So next picture, please. So these are also some items. This isn't straight off of a shelf in Connecticut, but it's examples of things that are on shelves in Connecticut that look a whole lot like our normal products. In fact, if you look at the trolleys, they're the green. The original one looks darn close to the one with THC in it. Hard to tell packaging. If you were a very young child, you wouldn't know. If you really liked this candy and mom said go grab it off of the convenience store shelf, you might walk out with the one with THC if mom didn't look at the package. So one way to tell is, as I circled in yellow, there's a little triangle with a cannabis leaf in it. That'll tell you the difference between that and the originals. The Stony Patch, excuse me, you can see the cannabis leaves widely on that, as well as the Oreos. But if you're looking or you're concerned, if there's a super young child that lives with you, or that you're with, look for that other designation there. They are illegal. They are not supposed to be being sold. They are. Store owners have told our team that it's profitable to sell these. And even though they're getting fined and they're getting in trouble, we're finding that upon a repeat visit, often those products are back out. So it is an issue that we are aware of here at DMHAS, the Department of Consumer Protection, and DRS. What's the other one? We're aware. The state agencies are aware. We are doing compliance checks. We are looking for this. So if you see it, I actually have a referral email address that you can report to if you see it. So next slide. Revenue Services, DRS, Department of Revenue Services. So here are the drinks that are out here now. The law in Connecticut states that a package store, so if you're a certified liquor store, licensed liquor store, or a licensed marijuana cannabis dispensary, you can sell these. However, as you might imagine, there are these products on shelves in smoke shops and convenience stores and gas stations and things like that are being illegally sold. It can be hard to pick them out. I know like Monsters and Celsius and some of the energy drinks look a lot like these. And if you're not really looking closely, they might be mistaken. So again, in schools, I encourage you, if you're seeing that brightly colored can, especially like that one, the Crescent 9, it's like, well, okay, that's easily an energy drink, right? It's not. So just keep eyes open for products like this. And then the email ad or the website that is on this page will link you to a complaint form that will go straight to our Attorney General. And you're right, it's not a mistake that they look very similar. You're absolutely right. You're absolutely right.
And what I noticed about some of these too as well, the colors that they choose sometimes seem to make you think that it's healthy, right? They're
Yes,
using
yeah,
these sort of like tropical colors. It's not always like, I think of the original Monster where it's just like black with bright green, and you're like, okay, this
right.
is pretty much poison in a can. But these,
Yeah,
the colors look inviting, or they might even have words
right.
about healthy or natural, but it's anything but. So that's something that I've noticed with these products as well.
And again, I can't read the milligrams and what have you, but um, again, the dose could be 2 doses per can. So guzzling down one, before a practice to hydrate yourself can really end up in a very scary and unpredictable situation. So keep eyes out for that. Next slide. And this is like a new concern, but I have good news, so bear with me. So these are actually photographs from Connecticut establishments, and the products that I'm going to talk about are called Kratom and Kava, and sometimes they're mixed together, like in this yellow pineapple uh, drink here, um, combined together. Now, Kratom and Kava are unregulated as of today. However, I'm happy to say that some young people from Southington High School got together and they researched a lot about kratom, got very concerned about its effects on the body, which I'll talk about in a second. And they brought these concerns up to their legislator and had a press conference. And now the legislature voted on it, and kratom is going to be scheduled and taken off of the shelves so that young people do not have access to it. Because as of this picture, anybody could go in and go ahead and purchase these drinks. And I'll tell you what's dangerous about them on the next slide, I think. Yep. So what they're finding is that kratom and kava are acting like opioids in the brain. So their molecular structure is attaching to the same receptors in the brain as opioids do. So it doesn't shut down the respiratory system quite as quickly as an opioid, but it is having a very negative impact on some users, and addiction is happening quickly because of the adherence to those receptors. Withdrawal off of these drinks and edibles and things like that is being found to be very aggressive, very painful, very difficult. And some users are turning to opioids that are cheaper and in some places easier to get just to stave off that withdrawal that they got from these energy drinks. Okay. We have contacts in Yale, not yet. There's not, FDA is not regulated it yet. Some contacts that we have at Yale and Bridgeport ERs are saying that they're seeing not so many teenagers, but like 20-year-olds that are coming in horrible withdrawal, and it looks like opioid withdrawal, but the only products that they've used are the kratom and the kava. So they're having to be treated with medications like Suboxone, buprenorphine, things like that, which is what opioid use disorder is treated with, just to get off of these products. So definitely not healthy, definitely not of the earth, and can cause some serious damage. So if you're seeing any of these products in the school, it is absolutely of concern. Next slide. Oh, good news. It's actually being scheduled in Connecticut as a Schedule 1 substance. And I've heard that as early as January 1st of 26, it's actually going to be passed, and these products will not be able to be sold in the manner that they are now, because you can literally walk into a smoke shop now and see a display, as wide as the wall of different products like this. So a lot of the sales are going to have to change. They're going to have to card every single person that uses them. So there'll be an education period, there'll be a transition period, but we are in Connecticut moving toward removing these dangerous products.
And I think
All right.
Claire brought up in the chat a really great point that these are being advertised as an alternative to using quote unquote drugs or
Yes.
substances, right? It's
Yes.
that alternate to sobriety, when really it's more harmful than some of the
Yeah.
things that you're supposedly trying to avoid by using these substances. So I'm happy to hear that this is going to be taken more seriously and have more restrictions here in Connecticut, because it is scary
Absolutely.
as that point that the FDA hasn't regulated that. So then you think as a parent or an adult or even as a child, like, oh, that FDA, this is on the shelves. It's at a gas station. Why would it be
Right.
dangerous? They
Right.
wouldn't let
We
us.
make
They
a
wouldn't
lot of
let you sell it.
assumptions.
Yeah.
Yes,
So
yes. It's absolutely true. And really, I don't know if anyone's from Southington on the call, or I really give a huge shout out to the efforts of those young women, and to research it, to really be concerned with it, bring it to widely through the legislature, and really pushed for this result that we're getting. Yeah, absolutely. Go Southington. They did a great job. And that's prevention in action. They're involved in our prevention work. So that's one result of great prevention going on. Okay, off the drug and alcohol topic for just one brief second. Um, I could talk to you all for an hour and a half just on problem gambling, but I have colleagues that do a way better job because it's their wheelhouse. So briefly, as you may know, problem gambling in Connecticut high school students, it's not happening at the casinos, it's happening on their phones. Um, Apps like FanDuel, DraftKings, Fanatics are allowing an an uncountable number of bets to go on live during games, before games. You can bet on, will the coach get Gatorade dumped over him, and what color would it be? It's incredible, the ability to pour your money out into your phone at this point and maybe get some cash back, and most likely not. There's online casinos that can be played. There's online and in-person lotteries, obviously scratch tickets, which are on Christmas. I know that people use those as stocking stuffers, but our problem gambling colleagues would say probably not the greatest thing to introduce young people to, as it has that addictive quality of that hope, right? That hope that maybe I'm gonna, and the first time you do hit something, it feels really good. And some people have a real hard time not doing that on a regular basis. One frightening stat is gambling has the highest suicide risk of all addictions, and increased reports of anxiety, self-harm, depression, and white males at the highest risk now. We just anecdotally, real quick, we have young people that work for our department, and we did a training with them. I want to say it was maybe 30 high school students from across the state, and they were shocked that the activity that they were engaging in on their phones was problem gambling. Oh, did you bet on this, did you bet on that, talking to their friends, and the amount of time they were spending invested in making bets, deciding what bets, fantasy football, things like that. A couple of those young people just in that group of 30 were like really concerned about their own behavior as well as some of their friends. So it's definitely an issue that we've got going on in Connecticut. And next slide. If you all are interested in hearing a lot more from our experts, this is a workshop coming up in March that is specifically for people that are engaged with young people on a regular basis. So school personnel, absolutely, this is for you. It is free. And as we've shared, this information will be in the slides that you get. And you can also go to the connecticutclearinghouse.org to go ahead and register for that. I don't think it's live yet, the registration, but it will be probably after the holidays. And if you needed immediate information, the Connecticut Council on Problem Gambling, there's their webpage, their hotline, and some of the services that DMHAS problem gambling. We have a self-exclusion program, training and resources, and there's also a webpage from DMHAS that has additional information and resources. So keep that on your radars. And I highly encourage you to attend any of their trainings because they're very, very good and very, very clear about what looks like a problem and then how to help.
Kelly, real quick, we had a question in the chat. In these resources, is there information on, support groups or resources specifically for youth and
Yes.
potentially parents or adults, caregivers? And I'm
Yes.
also thinking that, this could be a great topic to bring into our health classes at school. So is there any
Absolutely.
information you can give about maybe how to make those connections and who in your local folks might be able to help? I have an idea of who it is, but I won't steal the spotlight.
So yes, actually, in a couple of slides, I will be talking about exactly this. Within each region of the state, the DMHAS regions, we have a coordinator in each region that can come out to your school and talk specifically on this, on vaping, on cannabis. So we have coordinators for each topic, and they are available with presentations. All of it is free, and they can all come out and address any of the issues, share information, share resources with you. And there's a whole slide, and the contact people are on the last couple of slides for all of these topics. Okay, so a little bit about yes, and the websites will definitely be able to provide you information. And if you get stuck, the DMHAS person is also named Kelly Lepard, and her contact information will be at the end of this presentation too. So we all, if we're old enough, we remember the frying egg in the pan. Here's your brain on drugs, right? Or Reagan's Just Say No campaigns. And while that had its place, and it was very well intended, it's not necessarily what prevention looks like in Connecticut now. Connecticut follows the strategic prevention framework, which is a public health model that includes this kind of circular piece the kind of flowery thing here on the right. It's scientific, it's data and evidence based, and really pulls in and requires multiple partners. And I cannot emphasize enough how critical schools can be and have been in prevention within the community effort. So I'm so honored to be able to talk to you all about this because there's so many ways that the schools can have an impact without having to take on something new to your giant plate. It's kind of like a perspective shift a little bit that I want to share with you guys now. So next slide. So with prevention, every community that is engaging in this SPIF process, they're doing needs assessments, they're doing student surveys, they're looking at crime data or juvenile review board data or suspension data from the schools and things like that. And they're identifying the risk and protective factors that are driving either, poor mental health or substance use in their communities. And I'm going to share with you the top few that our coalitions are addressing. And the number one risk/protective factor, and it can be both, is youth perception of risk of harm of use. So common sense would say if a young person thinks it's risky, they might not use, right? So if they're terrified that, a pill is going to kill them, it's likely they're not going to take that pill. Beyond physical and mental harm, this also includes whether or not the young people think their friends disapprove, their parents disapprove, and then what are their consequences going to be at school and in their family, right? So if a family unit is very clear on consequences and then engages those consequences if something goes wrong, it's going to increase the youth perception of risk of harm, right? Same with the school. If they, one of the questions on some of the surveys is, do people get in trouble for breaking school rules? And if the young person perceives, well, heck yeah, justice is swift and scary, they're less likely to engage in those risky behaviors, right? I'm thinking like if they're involved in theater or clubs or of course our athletic teams, if they know that the the consequences are going to be something very undesirable, then they are less likely to engage in that behavior. But on the other side, if they know it's kind of a slippery slope and coach or advisor or whoever is going to look the other way, then they're more likely to engage. I've worked with many, many schools that have one athletic program that not one single person is going to use because the coach has bounced some of the best players. And at that same school, another team is known as the party group because they also know the coach. It's kind of that no, don't ask, don't tell. So just simply in talking to young people as a school about substance use and enforcing the policies that, of course, all of you have, that can greatly increase their perception of risk and decrease their chance of use. So it's not rocket science. It's subtle, but it's all in what our young people are perceiving their risk might be. Next slide.
And I just want to bring up a point real quick because you're talking about, excuse me, athletic teams and things like that. But just keeping in your other clubs and your other organizations in mind as well. I mean,
Mhm.
I've heard of some pretty crazy, cast parties after the school musical, right? So it may
Yep.
not always be those ones that are depicted on, the partying high school football team. So just to
Right.
keep that in mind and the idea that your school culture and your school climate extends to those after school activities as
Yes.
well. Um,
Absolutely.
so as much as possible to have those advisors and those coaches and those directors know what the standards are and what your expectations are, so students are following those across all areas that touch your school community.
Absolutely. Thanks, Kate. So, these are some of the other risk and protective factors in Connecticut that our coalitions are addressing. I'm going to go through them fairly quickly. And Kate, if you want to click on as I do. So, family communication, if it's great and you're talking to your young people as early as second, third, fourth grade, you're making it conversation that can be had in the house, less likely your young people are going to use. If they have more caring adults in their life, so maybe the parents are, due to whatever circumstance, are having a hard time, they're not as connected to their young people as we would hope. Other adults can have a huge impact, and you all know that because I'm sure there's one, two, three, 100 kids that you've connected with, where your presence and your caring has impacted them. So, research and our own anecdotal stories show us that the more caring and connected adults that communicate with them about tough topics that a young person has, the better they're probably going to do. Connection to school, huge, huge. We see when the risk factor is disconnection to school, and communities really strive to improve that, we see the changes in use patterns get a lot better. The use is less, the perception of harm is greater. So school definitely plays a major role in youth mental health, as you know, and their choices about substance use. Sports and employment, as I shared about sports, like team culture can be a risk or a protective factor. If you're a freshman on a soccer team that parties a lot, that freshman's a lot more likely to use than their peers who aren't on the soccer team and aren't necessarily going to be around that kind of behavior. So being thoughtful about coaches. On employment, I just want to say this. Some school surveys have shown that a lot of people mistakenly believe that if my young person is working, they're too busy to drink, right? They're too busy to get involved in riffraff. Maybe, but some schools community surveys have shown that due to the nature of being around potentially older peers. So your 16-year-old might be working with a 21-year-old at the Clinton outlets, right? I say that because I live in Clinton and my niece works there, so I'm owning that. But they may be around these older peers and therefore be potentially at a party for the staff, or oh, that's just somebody I work with, I'm going to hang out with them, and then be introduced to some of those use behaviors. So just things to always be trying to talk to young people about. Um, our communities are looking at access. Fake IDs are easier than they have ever been, and they look so real. Young people are ordering them online through their apps, Snapchat, all those apps, they can get right to it. They're also ordering drugs and alcohol through the apps. Unfortunately, the social media companies are aware of this and they are seeking to squash it whenever it is found. But young people tell us I could hop on Instagram right now and have a delivery by noon. So just having that awareness, we can do a whole presentation for you on that if that is something that is of concern. And then obviously, as we know, if adults are using and young people are watching them use drugs or alcohol to moderate stress, to cope with different situations, then that's what they're going to mirror. And the access, obviously, if parents are using, it's right within their home and they might have greater access, but of most concern, they're seeing that that's a way to cope, or that's a way to just to handle stress, and they need us to help them with different coping skills. And I know the schools are brilliant at that, and you worked very, very hard at that, and we appreciate your efforts in that realm, because a lot of our young people are dealing with this at home, and it's wonderful to go to school to have supportive people without that issue in front of you, teaching you better ways. So we appreciate all your effort in that.
Yeah, and it's not always the ways or the substances you might think, right? It could be mom, dad, grandma had a long day at work and then they have 3, 4 glasses of wine with dinner,
Yep.
right? So it's those ways that even the adult themselves may not realize that it
Yep.
is a problem, or they may be, setting some unhealthy examples of how you deal with stress or with a long day. So
Yep.
just kind of putting that out there as well.
Absolutely. Thanks, Kate. I'm going to skip this one. What does impairment look like? You guys probably have that, but it'll be on a slide that you can return to later. Probably the next slide too, Kate, you can go through. Yep, signs and symptoms of a possible use problem. So I'll let you guys review that if there's somebody that you're concerned with. Next slide. We'll do a couple of these, Kate. Well, let's do the top three maybe. So put in the chat, what does lit mean? So if a student said, "Oh, he was lit," who knows what that means? Absolutely. Yep, you can click on it, Kate. I see there they got it right. Yep. Lit is slang for drunk, high, impaired. Sometimes lit just means it was awesome. But yes. All right. Do you know what a plug is? That's the dealer. So, oh, I got to call my plug. That is your person that you are getting whatever substance with. Okay. All right. Who knows? What about dope? Any guesses on what is dope mean nowadays? I think we're still on lit with what I'm seeing coming through.
We got some people are getting it. This one caught me too.
Yep. Right. Yep. So dope, like in the 70s, was called marijuana, but it's also, oh, that's dope. That's good. Cool. All right. Um,
Can we
yeah,
do
you
a
want to
couple
do
more? Because I
drink?
think these are fun. Yeah, and I want to do blues too, because I didn't know blues.
Okay.
Okay, we'll start with blues. I did not know this one.
Oh, you know what? I don't know if it might go straight, it might go across. So we might have to do straight dabs, carts. So let's just do,
Okay.
so straight is, I'm fine. I'm straight. Dabs is smoking the high potency cannabis wax. And that again is the really waxy substance that they typically use through a bong. It is inhaled and 70, 90% very, very high potency and very huge high. Carts are, Kate got this one right when we were practicing. These are the cartridges for vapes. Yep. Gassed. I was gassed at that party. He was gassed. She was gassed. Yes, impaired. So let's have you all take guesses at dirty Sprite or drank. They mean the same. Any guesses on drank?
I think we have was it Lil Wayne to thank for everyone knowing this one? Maybe dating myself here a little bit, but yeah, that's what it was.
Yep.
And then the final one is blues. I did not know this one at all.
Any guesses for blues? Chelsea says, yep, fentanyl, oxy,
Yeah.
Percocet.
So yeah, blues is
Yep.
fentanyl and oxy. I did not know that one.
Yep. Yep. So if you hear young people talking about blues, definitely perk up your ears. Yep. All right, great. Thanks for that, Kate.
Yeah. Thank you. It was a good activity.
Yeah. I wish we had more time. Literally, all this information can have an hour and a half in and of itself. So I apologize for it being so surface. There's really a lot more I wish I could share with you. But so we talked about the common risk and protective factors that our coalitions are addressing in Connecticut. And the strategies being used, one of them is a coalition. And there, there's a map coming up that you'll see. The majority of Connecticut communities have coalitions which bring together all the sectors of a community. So there's school personnel, there's police, there's government leadership, there's parents and youth, there's civic organizations, medical, youth serving organizations, all of the media brought together to focus on those risk and protective factors to address what's going on with youth in their communities. So that is one very well used strategy that works in Connecticut. General education, like what we're doing right now, sharing some of the facts, some of the trends, letting parents know how impactful their voice can be with their children, teaching them these skills, or skill development is right below. Many of the coalitions and schools are implementing surveys with their young. Maybe some of you on the call right now know that these surveys happen every 2 years in your school, and largely that is coming from the prevention community. A lot of the grants that either come from DMHAS or come from SAMHSA that communities get, they want you to look at that data so that you can try to decrease those use rates and those perceptions of harm, or increase perceptions of harm. Interviews of key personnel, interviews of young people, empowering youth. Some of the most impactful prevention happens when youth are driving the bus. When our young people are involved, it hits differently. It hits deeper. As you heard about Southington, they're a great model for letting young people really show the way. And then, of course, enforcement. The Department of Consumer Protection and Revenue Services and DMHAS work closely to enforce our sales laws, working with the merchants that are selling these different products, making sure they're IDing everybody, providing training for new employees, as well as getting products to these coalitions so they can partner with some of the merchants. So all of that put together is largely what's happening in our Connecticut communities for prevention. All right, next slide. So if this is spurring something in you, and you're like, whether it's in your role as a school staff person, or maybe you're just really interested in this and you want to get involved in your community. As I said, the map is coming up, so you'll be able to see which communities have LPC, means Local Prevention Council. So you may want to look in, I almost said yellow pages. That tells you how old I am. You look in your blue pages in your phone book. Google your social, human, or youth services departments. Typically, the coalitions are housed there. Haddam Killingworth, for example, has a 501c3 that houses their prevention coalition. So you could probably find information on that or prevention in your town, and that may come up. You could include information from any of these presentations in your classes, in guidance. We have so many materials at the clearinghouse and through CERC that you could just have out for students. Attending coalition meetings, when school personnel attend coalition meetings, it is like Taylor Swift walking through the door. We love when school personnel are involved because you're with the kids the most. You are seeing the most. You are knowing the kids so well, and you have a wealth of information, knowledge, and insight that others don't have. So when school personnel are involved, it's really a critical, important moment, and we urge you all in any way to provide your information and what you see. And also, maybe you have some solutions that no one else has ever thought of, and most coalitions would be eager to hear all of that. Empowering youth always is a good idea. So all those efforts that you all are putting in at school to provide opportunities for learning, to provide opportunities for leadership, that is prevention. And thank you for those ongoing efforts that you all provide every day. And talking to them. Talk to them. You overhear, oh, so-and-so's got some blues and we're going to get lit. Don't just let that go by. Be like, hey, you know what? You all really matter to me. And talk to me, because they're so afraid of the consequence at times that they won't be open. But you all know who you are, and you know who's in your building and who has that kind of a relationship with young people. And just simple conversations like that can really let youth know how much they matter. And when youth feel like their school and their community care for them, they tend to use less. It's community values youth is one of those assets that some other coalitions really focus in on. All right, next slide. Oh, I forgot. So here's my map. So the dark blues are communities that have coalitions, local prevention councils, that are funded through DMHAS grants. So that's a large majority. The green, DMHAS grants and other funding. So they maybe get private funding. They may get a different grant from out of state. Federal grants. LPC onlys, so just getting DMHAS funds, are the green. Other funds from, like I said, it may be a federal or, some foundations fund some of the prevention activities, are the yellow. And then unfortunately, we have a few that don't have funding. And they may share resources with other communities, but we're working hard to get them all connected and funded. Here is a list of towns that are funded directly by DMHAS. Myself and my assistant director, Stephanie Welch, oversee the prevention activities in these towns, and around 12 of them, they're just getting started. So we're excited to be bringing prevention and get that funding into communities that didn't have it before. Here's some photos. On the bottom left are those Southington youth that really did that legislative advocacy. Some young people in Stamford and New Haven and East Hartford. Those young people were presenting at a conference. So in Middletown, right there in the middle. So as far as resources for you all, here's some of the contact information, and you might want to get your phones out if you want to grab a couple of QR codes, because they're coming. So regional behavioral health action organizations, RBHAOs, you may or may not be familiar with, but they're DMHAS designated sections of the state. You can find on the map where your community that you live in or you work in lies. The names are in that small box. So down in the southern part of the state, we've got the hub. In our western part of the state is Western. Top, so kind of Hartford County is covered by Amplify. The green, kind of south shoreline, is APW, BH Care, and then the far east is CRAC. And on the next slide is the contact, oh, not the next slide, but there'll be contact information for those RBHAOs in a QR code. So as I was referring to a few minutes ago, the RBHAOs have specific coordinators for specific topics. So they have a vaping coordinator who, for example, could come to you with factual presentations for staff, for parents, and for youth. They have quit resources. They have ways to do alternatives to suspension. They've been working with several districts on, okay, we catch a young person vaping, we don't want them out of class. What are some alternatives? And there are educational programs that these coordinators can implement and help you with to work through issues like that. And then again, if maybe you have an environmental club and they're passionate about this, these vaping coordinators could potentially provide information to them about that issue. There's cannabis coordinators that can come out and do the same thing. Suicide prevention and postvention, if you happen to have a tragedy happen in your community, there are representatives from each RBHAO to directly address that. There are gambling coordinators in each region to come out and talk to your staff, students about gambling. They can come out and do Narcan training, which is the medication that reverses opioid overdose for students, for teachers, for staff, for everything. They can provide data on what's going on within the region, and then also provide all the different treatment resources. So the next slide with the QR code will be very helpful for you if you want to reach out on any of these topics, and you would just call the RBHAO, say, you know, I heard this presentation, I'd like to talk to the vaping coordinator, can you connect me? And they'll be able to do that. Lots of resources that we would really love to pair with you all, and all of it is free.
I just put the link in the chat as well. And the
Perfect.
QR code will be available when we share the slides.
Yes, thank you, Kate. So let me give you a little bit of information about CERC, the State Education Resource Center. Their building is in Waterbury in the old Timex building, if you're old enough to remember when it was that. It's a beautiful space. If you're ever nearby, you might want to pop in. DMHAS, through a SAMHSA grant, has been able to fund with them the creation of an online and in-person library of substance use prevention and mental health promotion curriculum. So for you all, they have an entire room, an entire webpage filled with different curricula, different books, lots of different information on special populations, whether that's, you know, LGBTQ, people of color, urban. The variety is vast and complete. The technical assistance that they provide under DMHAS and as well as within their organization can help the schools with, you know, recognizing a need for prevention curricula, matching you all to a curricula that would fit your district, your students, your school. And they can also provide support and guidance for your school climate planning, which I know is, you know, it's been legislatively mandated, and you all are working on that, and they can provide you with some technical assistance on that. They have some guidance documents that you may find helpful, as well as just, you know, years and years, decades for some of them of experience working with schools and helping with these sorts of issues. So the link or the QR code is there. they have a short video that I'm not going to play. It's probably about 4 minutes, but Kate can show the slides again, and you can click on that and just get a brief overview. You'll be able to see what their site actually looks like. And I invite you to use their resources. And the young woman at the beginning of the slides, Bianca Irizarry, who wasn't unfortunately able to be with us today because she had to be in district. She's out there serving a school today. So her contact information is in the beginning of the slides, or go ahead and use the QR code. And some of you 2 months ago saw a brief presentation by the Clearinghouse. If not, the Connecticut Clearinghouse is also a brick and mortar building. It's a library where you can walk in, you can pick up books, pick up brochures, everything. You can put your hands on it, check it out. They cooperate with the Connecticut Library. So even if you drove to Plainville, picked out a book, you could return it locally to your library and they'll get it back. There are also a myriad of resources online that you can order, you can print off. There are fact sheets, there's help, there's campaigns, just so many different things that might be useful completely in so many different ways in your building. Mental health promotion, some of the gambling stuff is at the Clearinghouse, suicide resources, lock boxes for medication. It's quite an impressive array of information that they can provide. They also have mobile resource vans. If you happen to have a health fair day or something like that, you can invite the van to come for free and provide all of these materials for free as well. So I highly recommend checking that out. Here are 2 campaigns. Change the Script is primarily about opioid use, Narcan, safe storage, fake pharmacies, things like that. If you go to UConn or Quinnipiac basketball, hockey games, you may see some of the Change the Script messaging. And the bottom one is about cannabis. It's beintheknowct.org, and it is about the laws. It is about harm to youth, harm to people that are pregnant. So many resources on the Be in the Know site that I encourage you to take a peek at it, use it personally, use it professionally. Please share with others. Next slide. Gizmo. I hope some of you know Gizmo. Gizmo is a real live dog who is 15, and he has been our face and heart for suicide prevention. And this particularly, if you happen to be an elementary school rep on the call right now, Gizmo is an amazing way to start talking about emotions and leading into suicide prevention. Obviously, we're not talking about suicide with our youngest children, but it's a great intro, and the resources are free to anyone in Connecticut. Yes, there's a book, and like I said, he's a real dog, and he has made some visits, but at 15, he's kind of slowing down, and he's got a brother that is starting to get his feet wet, get his paws wet in this, and we'll be also doing visits. So I encourage you to check out that webpage as well.
So,
Oh,
some
I
of you
see
may
that.
have seen in August, September, in collaboration with GCF, we delivered school mental health resource kits. And in those bags, they were blue bags, for elementary schools that have grades 3 and 4. That's what the Gizmo curriculum is for, grades 3 and 4. You did receive copies of the Gizmo book. It is available for free in both English and Spanish.
Yes. Thank you, Kate. And like I said, Gizmo is doing some visits. I saw a few chat questions. Will he come? Check out on the webpage. I know that some schools have requested and he's been able to make it. I think it just depends on how his health is doing and how ready his brother is to start doing that work. Again, another QR code. The Connecticut Suicide Advisory Board has a great webpage that you may be familiar with. If not, check it out. The Connecticut Suicide Advisory Board also has regional suicide advisory boards, which are under the RBHAOs. And you can access their services, as I mentioned earlier. And then here is the webpage connecting you to the gambling awareness and resources. For treatment and intervention, I know there was a question leading into today, and primarily the Department of Children and Families are responsible for the treatment and intervention side while we're on the prevention side. But the website connecting to carect.org is a great resource if you're looking for referral services or just more information. And also 211 has all of the information about where young people or adults could be referred to. They should have bed opening information. And then, of course, always, for mental health assistance, 988 can be text, can be called 24/7. Even if you're not imminently suicidal or knowing somebody, they can still be a reference for you to provide additional information or resources. And I think so. The next couple of slides are all of our contacts. So I'm Kelly Edwards. My primary is opioids and some alcohol with some of the communities that I'm overseeing. Danique Vadima Lewis is the cannabis manager. Andrea Duart, suicide prevention. Tom Fulton, primarily cannabis and vaping. The other Kelly, as we call her, or sometimes I'm the other Kelly, is there for problem gambling. And then Brian Champagne oversees the special investigations with our tobacco merchants. So if you have concerns about, sales to young people or illegal products that you're witnessing, you can also email Brian and report those to him, and we will get them on the visit schedule. And then I think our directors, Stephanie Welch is on the call, so thanks, Steph, for being here. And our director is Sarju Shaw. You can email them with any questions or concerns that aren't covered by any of the rest of us. But we appreciate very, very much the partnership with SDE, the partnership with you all on the front lines in the schools with our young people. We're all working toward that same ending of health and smart decisions and sending them off to their next steps in the best way that we can. So we value you. We encourage you and invite you to be part of prevention more than you already are if you have time and interest. And if we can answer any questions or provide anything for you, please reach out. And I think that's it for me, Kate.
Thank you so much. We've got about 10 minutes left, so feel free to put any questions you may have in the chat. I'm going to advance this to our last page here. I see some questions about the mental health resource kits. I just put a picture in the chat of what those look like. So they were delivered about end of August, maybe first week of September. They were hand delivered or should have been to all K-12 public schools. We only had enough resources and funding to do one bag per school. So if you haven't seen it, I encourage you to check with maybe your front office staff, your principal, one of your colleagues may have had it. A lot of the information that's in there is things that we are going over in these presentations. I'm working on a virtual version of the toolkit. We're also looking to expand out a website that has the information in the toolkit, as well as a one-stop shop for all of your substance use resources, all of your suicide prevention resources. So you can see I'm going to put these links in the chat as well. We have our CEC request form, the course evaluation, and the link to register for January's student support series, supporting students exposed to intimate partner violence. Thank you all for your patience. I know that this this link was not available on the flyer. As some of you may know, we are in the process of trying to do a tech switchover to using a Zoom platform. Unfortunately, I was hoping that would be available in time for January, but it was not. So we are using Teams again, although Teams cooperated this time. So hopefully that will continue. I will be sending out an updated flyer soon. My goal is to do it before the holiday break, but please feel free to share that information out. So I did see a question about nurses eligible for CECs. That's something you would have to talk to your accrediting body with. The requirements are different, but this is approved for LCSWs, LMSWs, LPCs, licensed psychologists, and licensed I got counselors in there. So sorry, Kelly, if you see some questions coming through in the
Yes,
chat. Yeah.
I do see one from Polly that before we hop off, I wanted to, she asked if there was any reason why females might be using more often than males. And my best response to that is mirroring it with some of the mental health data that we got, where our female students were reporting, yes, as Jacqueline said, more mental health concerns and issues. So a greater incidence of anxiety, greater incidence of depressive or feeling like things are not well, and greater suicidal ideation, not necessarily attempts, but as we know, you can't unlink substance use and mental health. They are intricately combined. And then you also think of socially, often our young girls are more influenced by peers than our young boys at different ages, and that too could just be a social reason why our girls are that way. But I would lean more based on my experience of it being connected to their mental well-being. But great question. I don't think I saw any others, Kate. So
I didn't either. I did just put a bunch of links in the chat there. So the CEC request form, the course evaluation, the registration for supporting students exposed to intimate partner violence, this link to the slides for this presentation, and our student support series playlist on YouTube. This will be uploaded. I'm hoping to do this before the holiday break, but some of my colleagues who handle these pieces may have been taking a little bit of an early start to their break, so I'm not sure what that timing will look like. Again, I'm going to try and do this before the break. So thank you all for joining us, and I'm so excited to continue this series with you all in the new year. Have a safe and healthy holiday season, and we look forward to seeing you all in January. Wow, I'm too hard. January. Clearly, I'm ready
thank
for
you
break
again
too.
so much. Thank you so
Take
much, Kate.
care.
And thank
Thank
you all
you.
for being here. Happy holidays.